or therapist. George examines Margaret and changes her to oxygen mask. Peter is interrupted by Dr. Jones, who needs help for Peter. Peter immediately goes to help Dr. Jones. Peter acknowledges the information, and starts looking for Amy to tell her about the mask. But George sees Peter. Now, Peter is distracted, you see, by George on the way. Now, that means Peter can no longer tell Amy about issues around oxygen, George receives a state, so he's paged to say, hey, go quickly to another floor. So, okay, I think I went from top to bottom, but you kind of like flow the whole thing and you can see the different parts and what happens. So flow mapping is very, very, very crucial, because now once you have agreed on this flow or the chain of events, I mean, if we are 6 or 10, we are now on the same page about what actually happened. And remember, don't jump steps. When it's time to determine what happened, don't focus on the solution. This is not time for the solution. You do this, then you have to go and see. Go to the ward. Go and see. Go to follow the path followed by the porter. Check if the emergency equipment are easily accessible on that path. Check the response. Check the team. Check radiology. If someone gets a cardiac arrest in radiology, who responds and do they have the capacity, the right equipment, and how long does it take? So you're going to do all that now to fill in the gaps on any of this. In the ward, you ask them, what is your protocol on your risk assessment in terms of clinical risk assessment for patients during admission? Because if it's an elderly, there are special things you must write, that they should not be walking alone. They must be in a bed where they cannot fall over, nice labels and all those things. So if you do not have an admission clinical risk assessment, it's going to be a problem, So we were discussing here what happened, right? Now, the second part is, what should have happened? Now, it's not there, it's to say, so in terms of this process, what should have happened? So if Peter was busy, could Peter have delegated another person? It depends on the protocols. So what would have happened if the hospital had good evidence-based procedures? So you have to read through the procedures, your clinical risk assessment procedures, your clinical standards, interview as well the department heads or the expert in the space to say, what could have happened? What are some of the things that are barriers for safe practice in our unit? So very, very, very important, because now you're going to compare what the clinical protocols or hospital policies and the experts say versus what actually happened. And then, you say, okay, but then if there's this gap, why were there the gaps? What are the causes and the contributory factors? And step 3 requires you, to be very good at root cause analysis, because now in determining the causes, at the heart of it is your root cause analysis, and being able to be a person who say, what are the direct causes and what are the contributory factors, right? So your direct causes are the most apparent, your immediate reasons for an event, and they're generally easy to identify, but they are usually not the causes. Remember when I asked, why did Margaret die? You all said, hypoxia, cardiac arrest, So, and they are not usually the causes that ultimately influences whether the event will occur again. In other words, direct causes can be symptoms of another large problem. The tip of an iceberg. What lies under the water or under the ocean there? That's what you need to get. You need to get to the bottom of the issues. And I can tell you, the contributory factors are more indirect in nature, but they are the ones that you want to focus on. Because if you can clearly diagnose what contributed to the outcome, indirectly, not necessarily the hypoxia, but you will win. And to do that, we've got a number of tools. And I'll show you some videos. We have the cause and effect diagram. It's called the fish bone. I don't know if you guys have seen a fish. Other people call it what? Ishikawa diagram by the Japanese guy who developed it. And then you've got your 5 whys. And then I think I've also showed you a process map